So good afternoon, everybody. It is just after midday. Welcome and thank you for joining us. My name's Alex Ball. I'm the Director of Communications and Engagement for the Clinical Commissioning Group here in Nottinghamshire. So we'll be starting in just a moment. I see lots of people coming into the meeting room. So a virtual version of people coming into a lecture theatre and starting to find their seats. So you're all very welcome. I'm going to carry on just filling the time ever so slightly for a minute or two whilst people come into the room. So we haven't yet started, but thank you very much to everyone. I can see 203, 204 people who have joined us so far. So I'm going to give it 30 seconds or so, and then we will kick off properly. We'll just allow a few more people to join us today. I'm again very grateful. Thank you for everyone making some time to join us today to talk through this important topic. So I think we will make a start. So I'll once again just introduce myself and also introduce my colleague. So hello and welcome. My name's Alex Ball. I'm the Director of Communications and Engagement for the Clinical Commissioning Group here in Nottingham and Nottinghamshire. I'm also joined this morning by Dr. Hilary Lovelock, who is a GP in a practice in Huthwaite and is also the clinical lead for the vaccination programme rollout here in Nottingham and Nottinghamshire. So I don't know if you just want to say hello quickly, Hilary.
Hello, yes, this is a massive programme, and we are definitely getting on with it in Nottinghamshire now. And I'll tell you a bit more later, but it is, I think as everyone is going to say, this is the biggest vaccination programme that has ever been done in the history of England, the UK and the world. And we are on a marathon and not a sprint. It is going to take time. Yes, so let's discuss the programme.
Brilliant, thanks Hilary, that's a really helpful starting point for us. So I'm just going to do a couple of bits of scene setting and a bit of logistics for today, and then I'm going to hand to Hilary to talk to us a bit about the situation that we're in and where we are with vaccine overall. So as I've mentioned, I'm from the Clinical Commissioning Group, so many of you will know what a CCG is, but in case you don't, a CCG is part of the NHS. The role of the Clinical Commissioning Group is to plan, buy and monitor healthcare services. So whilst we're not a hospital, we don't directly employ doctors and nurses, our role is to coordinate and plan for the delivery of healthcare services across the patch. And we work with all of the other healthcare bodies across our area, and also work in partnership with the local authorities, so the councils, other bodies like the police, the fire service, in a sort of clustering called a local resilience forum, which has been leading on much of the work of the pandemic since February, March time. So we're here talking particularly from an NHS point of view, but I wanted to reassure you this is a combined and joined up plan led by the government and being delivered locally in areas all across the UK. So if we could just have the next slide, please, Jane. So again, thank you very much. I'm absolutely delighted that we've got 230 or so people along today. It's incredibly gratifying to hear so many people, see so many people who've given up a part of their time to understand the situation here, and I hope be able to help us with what we need to be doing over the coming months. So I'm so pleased that there's so many of you here, because as Hilary's already mentioned, the work we have ahead of us to deliver this vaccination programme is absolutely enormous. I'm really confident we will do it and we will achieve what we need to do, but it will be no small task. So we will need absolutely everyone across that health and local authority and all the other bodies that I've mentioned, but also leaders like yourselves within communities to make sure that we do land it. So the purpose of today is to give you the information that we have at the moment and start a conversation about how we will give you more information in the future, and also about how you can help us in the future as well. There's a really important caveat on this slide here, that the information we're going to share is up to date as of this minute. We've literally been changing some of the details this morning on these slides. And that's not because we're, unplanned or anything like that, but this program is changing incredibly rapidly as new information emerges, as new vaccines are developed, as new methods and techniques are developed to deploy it. So things are changing really, really rapidly. So I'd ask for your patience and your understanding about that, because we don't have all the answers yet and things will continue to change. But our commitment to you is that we will keep you up to date as we possibly can. And we'll talk a little bit later on about how that will work. So if I could just have one more slide, please. So I can see a couple of colleagues have already done this. I'm sure everyone has learnt about how Zoom works over this year, but just in case you're not familiar, if you move your mouse down to the bottom of the screen, you should be able to see two sort of speech bubbles with Q&A underneath. If you click that, then you can tap your question into the Q&A section. And if you wish, you can mark that as anonymous, but equally we're very happy to hear from people directly, and sometimes that's helpful to sort of be able to follow up on specific questions. But either with your name or anonymously, if you tap your question into that Q&A section and click send, we will then be able to pick that up in the second half of the conversation today. So that's everything from me to kind of introduce things. I'm going to hand over to Dr. Lovelock now to just set the scene a little bit on the COVID-19 disease and also where we are with the vaccination. So over to you, Hilary.
Yeah, so first of all, I think what we should really do is just go through again what COVID-19 actually is, because the whole problem about the COVID vaccination programme is we will not be free of COVID in our communities until we are all vaccinated. And that will be way on into next year. You know, everyone's saying, will we be free of it by the summer? So up until then, if anyone has a high temperature, a new continuous cough, or has a loss or a change in their sense of smell or taste, then if you have one or any three of those three of the symptoms, we would recommend or absolutely say it is imperative that you get a COVID test. So the vaccination has now come live. We are using at the moment the Pfizer-BioNTech vaccine, which has passed the regulatory authorities of this country, the MHRA, and that happened just a fortnight ago. So if you were to receive that vaccine, you have to have 2 doses. The first, which is then followed by a second one, which must be at least 21 days after the first, but it can be a little later. And if you are given an appointment for the first, you are automatically given an appointment for the second. So don't worry about not getting your second vaccine. Then I have to say, you are still not covered and not immune from the vaccine for another 7 days after your second vaccination. So what we would say is, please do not contact us for the vaccine. We will contact you, because there is a national programme that we are working through, starting with the highest risk and moving down. And we'll go through that in a minute. But absolutely, we will contact you, because otherwise we are overwhelming GPs and everyone. What we would say is you will receive a letter. And when you do receive that letter, please act on it immediately, because at that point in time, a vaccine will have been allocated to you. So it is absolutely important that you follow the details, which may be online or by a telephone, but contact us when you first get your letter. And the other thing is to say is because you will not be covered by, your immune system will not have covered you against the virus when you first get the vaccine, then it is absolutely important that we follow all the virus controls right up until the government lift them, in order to save lives and really to save the NHS as well, to protect the NHS. So that does mean we've got to be absolutely careful over hand washing, face, space, and particularly in this period coming up to Christmas, please, everyone, stick by the rules and remember that it is 5 days, 3 households, but that is the absolute maximum. Less than that will protect you. So then there is a few people who will not be able to receive the vaccine. Sorry about that. Let me just, that shows what the system is like at the moment. That was my phone ringing, someone else wanting to speak to me. So I should have switched it off. I missed that one. So the people who cannot receive a vaccine are people who are pregnant, people who are breastfeeding, those who expect to, or are planning to become pregnant within the next 3 months. And if you have had the vaccine, then you should avoid trying to get pregnant for the next 2 months. Everyone who's of childbearing age will be given a leaflet about that, and it will be checked at the time of booking a vaccination. But there is another important group, that anyone who has had a serious allergic reaction to either a medicine, a food, or a vaccine should not have the vaccine. Those people tend to be people who are carrying an auto-injector. So if you haven't got an auto-injector and you're concerned that you've had an allergic reaction, do discuss it with the assessor when you go for your vaccine. But the ones that are truly excluded from the vaccine at the moment are those who are carrying an auto-injector. And what we would say is, if you are ill at the time, do not attend for your vaccine. So if you've got a fever of any type, you must postpone the vaccine. But again, there will be how to cancel a vaccine. When you make your vaccine, you'll get that information. So just to come back to the priority groups, I'm sure you will have seen a lot of these nationally. And just to say that we did start vaccinating on the 8th of December, both at the University Hospital at Nottingham and at Sherwood Forest. Those are our 2 hospital vaccination hubs. And they are, as we speak, and have been for the last 2 weeks, calling patients that are over 80 or care home workers and frontline medical staff who are at risk of catching the COVID. So those groups are being prioritised because nationally, those are the ones that are thought to be at highest risk of either significant illness, or they are put at risk of catching the illness through their place of work. So I've had care homes say to me, so when is it going to be our turn for our staff to be vaccinated? What you have to understand is this is a massive programme. If you take all the people who are over 80 in the county and the city and the massive number of care homes we have, this will take time to work through. So we are working through, we've had 2 very successful weeks, and we're now being allowed to, once you've proven yourself, you can order more vaccine, but there is a limited amount of vaccine coming through into the country at the moment. And so they are trying to, and they are getting out to all places across the country, all the vaccine that has come into the country on a weekly basis. So it is definitely, I'm sorry, you do have to wait for your invitation to come, but we are working through it as quickly and as efficiently as we can. So I think I've covered some of that is that, yes, we are vaccinating those at highest risk, and we do ask you to wait. So please wait to be called. Over to you, Alex.
Thank you, Hilary, that's really helpful. So I've just got another 2-3 slides, and then I can already see some really helpful questions coming into the Q&A section. So we will go through those in a moment. So please, if you've already heard something that prompts a question in your mind, please tap it into that Q&A section down at the bottom of your screen, and we'll come to those in a moment. So as Hilary's mentioned, we've already started to offer the vaccine at our 2 hospital hubs, so at Nottingham University Hospitals and at Sherwood Forest Hospitals. And what we're planning over the coming weeks, it'll probably be just after Christmas now, that we will start to open other locations that will offer the vaccine. So these are going to be called vaccination centres and local vaccination services. So those vaccination centres are going to be in places like sports venues or leisure facilities or music venues, well-known locations that are on really good transport links that will make it very straightforward for people to access a vaccine. And then in the local vaccination services, sorry, if we just go back one, yeah, that's it, thank you. The local vaccination services will be slightly smaller again, and these will often be based around some of the bigger GP practices or some of our sort of smaller community hospitals. But again, there'll be well-known locations that will be well set up for this. So over the coming weeks and months, we will have many more sites and locations that people will be able to come to get the vaccine. But again, the really, really key message is, please wait to be contacted. When it's your turn, you will be called forward and you'll be given all the information you need then. So please do not try and turn up. If I could ask you to encourage people, don't try and turn up at any of these locations. Please don't call your GP. Please don't turn up at A&E to try and get a vaccine. I understand people are keen, but that's not helpful, and will sort of distract people from focusing on the measured way that we're looking to do this. So if we just have the next slide, please. So on the day when it is your turn, it's going to be a slightly different experience, isn't it? So you will be asked to keep wearing your mask. You will be asked to socially distance. We've done a number of practice trial runs, as you might imagine. We've set up a kind of dummy facility and helped people kind of work their way through it. But it's a well tried and tested process now that we're confident that we've got well set up. And you will be asked to make an appointment, as Hilary's mentioned, for your second vaccination, your second dose. And that's incredibly important because all the science, all of the trials and the tests that have been done on this vaccine tells us that you need 2 jabs to really make this effective. And actually it's after a week or 2 after the second jab that you're absolutely optimally protected. So it's not 1 jab and next day everything's fine. It's 1 jab, 3-4 weeks later, second jab, and a week or 2 after that. Only then have you got your full protection. So it's going to be really, really important that people respond quickly when they're invited for their turn, but also complete the course and have the second jab as well. So that's a really, really important message. If I could just have the next slide, please. So I've touched on most of this, I think. So the second vaccine is really important, the second jab, and making sure you stick to that set appointment that you'll be given on the day. There will be a few side effects. I mean, that's just a fact. Every medication has a risk of some side effects. And there's a link here that describes what we know about those already. Hilary's already mentioned the specific groups of people who it's not advised to have this vaccine. But there are, for everyone could have some of these side effects. So it's important that people are aware of those, as they are with any medication. And then again, I'll just stress it because it is so important. It does take a few weeks for your body to build up the protection that the vaccine gives it. So it's really important that people continue to stick to the guidance, continue to wear their mask when they're inside, continues to keep their social distance from people, so that we can carry on successfully deploying the rest of the vaccination programme over the coming weeks and months. So if we could just go to the next slide. Here's the email address for the team that are supporting this work, particularly in terms of helping share the information with groups like yours. We will in the next, hopefully today, it might just creep into Monday, but hopefully today we'll send out a whole pack, a whole toolkit that you can use to share this information with your groups, with your communities, with the organisations that you represent. And over the next few days and weeks, we're going to be working to make sure that's produced in appropriate languages and formats so that it reaches everyone that we need it to. And this final link on the bottom of this slide, and we'll send these slides out straight after the session, is a central web page that collates all of the available information at the moment, and that will be updated on a rolling basis. So we'll continue to keep you up to date and continue to share the information with you as it emerges. So I think this summary slide hopefully kind of chimed with what you've heard so far. And I make no apologies for really kind of repeating and stressing these really important statements. Please, please, please don't proactively contact the NHS to try and get a vaccine. Please don't call your GP surgery. Please don't turn up at the hospital. Please don't contact the local authorities or the councils or the NHS to get a vaccine. Wait for your letter, wait to be called forward, and then please react really, really quickly, because as Hillary's touched on, you have a vaccine effectively allocated to you by then, and it has quite a short shelf life. So you need to come quickly and get your first jab. We have prioritised who will be called forward first under the overall guidance from the government. So care home residents and staff, people over the age of 80, frontline health and care colleagues, that's first. And then we will work down that ladder that you've seen the image of earlier on. We will share this toolkit later on. And it's important that whilst we should be optimistic and excited and looking forward to the future when the majority of people in the country have been vaccinated, for now we need to make sure that we are sticking to the rules and continuing to keep ourselves and our families and our neighbourhoods safe. So I think if we click to the next slide, we should be on to the question section. So I can see a massive stack of questions come in, which is absolutely fantastic. I'm really, really pleased that people have got so much that they want to check and clarify. So I think, Lewis, you're going to try and gather those together and maybe theme them and ask me and Hilary to answer those as best we can. So over to you, Lewis.
Yeah, thanks, Alex. I will do. We've got until 1 o'clock and there are quite a few questions coming through. So I think it's just worth saying that if we don't get to your question after the event, we will produce a report and send that out so that all the questions will eventually be answered, but we'll start running through them. So somebody's asked about the prioritisation of vulnerable groups. So I'll just read this one out. Category 6 includes vulnerable people up to the age of 60. Would this category not include the BAME community in general because of higher risks? Or if not, surely it ought to extend, for example, to all Syrian refugees who are here under the Syrian Vulnerable Persons Scheme.
So maybe Hilary, do you want to, I know that's all been set nationally, hasn't it?
Yeah. It's absolutely being set nationally, and we will go down the cohort groups as they come. Nationally, they did not pull out BMAME as an absolute priority, so that people will go in their cohorts. But actually, if you have got a condition like diabetes or something, you will move up the ranking slightly. So, you know, people who are in the BME community have got healthcare conditions, but those cohorts have all been set, and those priorities as to where you move up are set nationally as well. So again, do wait to be called. And as far as the refugees are concerned and asylum seekers, there is a special work stream working on those to make sure that they're a priority group and they are not missed.
Thanks, Hilary. So there's quite a few questions on the role of community leaders and volunteers. So this may be one for you, Alex. So someone's asked, would it be possible to train community leaders to vaccinate their own community? But we've got quite a few other questions about the role of the voluntary sector and the role of volunteers more generally, if you can say something about that.
No, absolutely. I think that's a really excellent question, and one we'd definitely like to explore a bit more. We are asking and have been asking for the last few weeks actually for people to come forward to support the vaccination These are paid roles, so there is work available here to support this programme on a flexible basis. So you can not quite pick and choose, but you could be allocated to shifts that might work around your caring or other responsibilities. And there's a whole range of roles in there. Some of them need advanced or clinical experience, as you might imagine. There are a number of roles that will be open to many more people as well. So we will include in the pack of information that we send out a link to the website that lists all of those roles, that sets out the application process as well. And we'd be really, really keen to hear from people from all sorts of diverse communities that would want to be part of that solution. That if there's a specific piece there, we might want to follow that up around if it would be culturally helpful or appropriate for a community for certain types of individuals to be vaccinated on a sort of peer basis. I think we'd be really interested in understanding a bit more about that. But the starting point is, well, yeah, we have a central point where I think there's a sort of 8 or 10 different types of jobs now, from, you know, doctors with years of experience through to people who we might need to help with parking and logistics and sort of crowd management. So please, we'll share that link and have a look at that, and hopefully we can join something up there.
Can I just add, Alex, that very specifically, if we've got anyone on the call today from any of the Indian or ethnic minority groups and communities, we already know nationally that those populations are not picking up on the vaccine as quickly as we would have hoped. So we would like people to work in those communities, and if they're part of community or faith groups that could help us in any way spread the message to those groups, it would be really helpful.
Thanks, Hilary, and thanks, Alex. So there are quite a few questions on what to do if somebody refuses to have the vaccine. So I wondered if you could take that one, Hilary, but also linked to that, a lot of people asking what they can do to support people or encourage people who might be skeptical about taking the vaccine, which might be one for you, Alex. So what do we do if someone refuses to take the vaccine, and what can people on the call do to encourage people who are skeptical about the vaccine?
I think the problem, you know, there has been lots of misinformation going around that has been taken off lots of websites and, you know, social media. We have to say that you're not going to be protected against COVID if you don't take the vaccine. You are protecting yourself. It does not have any porcine or anything else like that in it. It isn't based on egg. We can only say that actually the evidence for the Pfizer vaccine is that it gives 95% protection against COVID, and no one who has had the vaccine in the trials has had serious illness that has meant that they've been admitted to hospital. So really the evidence is there that this protects us against COVID. And if we want to get back to our normal lives again, it is really sensible that we all get vaccinated, because then we are protecting ourselves. You're not just protecting yourself. We don't know specifically at the moment about whether it protects you from carrying it, but the likelihood is that you will not develop the illness. So you're less likely to pass it on to your elderly grandparents, vulnerable people. So we are protecting our family and friends by having it done, as well as protecting ourselves. And I think that's the best we can say to encourage everyone. I want to protect my elderly parents. So I think that's what I would say.
Yeah, so and that's absolutely spot on. There is no compulsion for anyone to have the vaccine. No one is going to be forced to have it. It's not mandatory. So if people wish to refuse it, they can refuse it. But that would absolutely not be our advice, not be advice of the national medical experts and all kind of, you know, medical bodies around the world. So there's, for me, I think a couple of things. There's always going to be a very, very small minority of people who, for whatever reason, reject vaccines. And we probably shouldn't spend so much time trying to argue with them or debate with them or change their mind, because it's probably not going to be fruitful. But there's a a larger group of people who have really legitimate questions and want to understand more about how this vaccine has been developed, how it works, what it means, how it would work for them. So again, we will share as part of our toolkit some of the national information, FAQs, materials that have been developed to help explain some of those questions and help people make a really informed choice. But to be really clear, we need the overwhelming majority of people in the population to have had this vaccine to make it effective. So I'd really ask for your support in working through how we can encourage as many people as possible to come forward and receive the vaccine.
Thanks, Alex and Hilary. It's probably worth saying we've had a few questions about follow-up meetings, but I think this is a channel of communication we want to keep open so we can help the people on the call to encourage people to take the vaccine up. A few have come through about the contact by letter, so a few questions. So there's one here near the top. Please, can you confirm that the only form of contact will be by letter and explain other measures to mitigate the risk of scams? So Hilary, if you could perhaps talk about how we're contacting people and what assurance we can give about the way we're doing that. There's also been some questions about letters going out over the Christmas period and also how we'll contact people who may not receive letters, so homeless people, for example.
Yeah, there may be two ways in which you're contacted. One may be the local programme. You may also be contacted by the national programme because they are starting a national programme of call out. What I ask you to do is to respond to the very first letter that you get, because that means you have been put as a priority. And so, yes, there will be a letter. Sometimes you may get called by a telephone call if we have got spare vaccine at the end of the day, because this vaccine is so precious that we do not want to waste any. So if it was your GP surgery, they might we will have some reserve lists, but they might just say, can you come? But in the first instance, it is you will receive a letter.
And I think it's a really helpful about how we can help protect people against fake letters or scams like that. So I think we need to take that one away because I'm sure that's been thought about on a national level. I don't have that information in front of me, but that's a really helpful reminder that we should, goodness, we'd hope that no one would be so kind of cruel or evil to do that. I'm sure there's some bad people out there that will try and exploit this in some way. The key thing, of course, is no one should be asked for any money for a vaccine. The NHS is the only organisation that has access to the vaccine. There aren't any private clinics offering it. So that's your first red flag. If anyone's asking for any money, it's not legitimate. So the key thing is look out for that letter, but we'll double check how the sort of security on that is going to work.
And is there anything at this stage we can say about how we'd invite people who either don't have a fixed address or are homeless street sleepers? I know it's early in the planning, but I just wondered if there's anything we can say at this stage.
Yeah, as we mentioned, the asylum seekers, we've also got specific work programmes for all those hard to reach groups. So that is the homeless, the gypsies, other hard to reach groups. So there is a definite programme we have following the COVID. We have very good lists of rough sleepers and sleepers, homeless, sofa surface. And there are teams out there trying to contact those groups as we speak.
Thanks, Hilary, and thanks, Alex. Just while we're on the prioritisation of groups, you had a few questions come through about people with underlying health conditions. So is there any factoring in of underlying health conditions in the order of prioritisation, Hilary?
Yes, there absolutely is. So further down the groups, those who will be put in a group higher than their age group will be those that were on the shielded list, so now called the clinically extremely vulnerable. But they will not come through until we get down to cohort 4, and that's where they will be put in. And then those with other health conditions who are under the age of 65. So normally, because the biggest risk of COVID is age, the biggest risk for having serious illness with a COVID infection is your age. So those that have other health conditions who are under the age of 65 will be brought forward into the programme with the 65-year-olds. So yes, age is the most important, but those two groups will be slotted in further down the programme. That list is available on the government website for if people want to check where it is.
I was just going to add, that's a national decision that's been the medical experts from the Joint Committee on Vaccinations. And again, we'll make sure that, I think that was included with the ladder and the images on the slides, but again, we will make sure that information is really clearly shared with people as well.
Yeah, it's on the small print of the ladder as you read down it.
Thank you. It's probably worth saying as well, we'll be sending a briefing out to all the participants in this meeting that has much more detail than the slide deck you've seen. So that will have a lot of links to the government information as well. So there'll be lots of stuff coming out after this meeting. We've had a few questions about staff testing and care homes testing. So will non-clinical staff be eligible as part of the healthcare worker vaccinations? And are we including care workers working in the community as well as people working in care homes, Hilary?
So I think people are now talking about the lateral flow test. You said testing. Well, I think we're moving to a different area.
My apologies. Yeah, sorry. Yeah, it's vaccinations for care home staff, people working in the community and non-clinical staff.
Yeah, so vaccinations for care home staff, they are being called as we speak to go to the hospital. So we are working through all the care homes across Nottingham and Nottinghamshire and calling in all their staff. But again, this, we have 300 care homes. This is taking a long time to work through. And likewise, we will be moving on to those that work in care in people's homes. So they do come up as a priority, again, according to the national guidance, that they are at higher risk and will be brought forward.
Thank you.
And the county council are working with us for those lists. That's the important thing.
Thanks, Hilary. A couple of questions about people who may not be able to leave home. So people who are housebound and over 80, or people who are self-isolating or can't get out of the home for any other reason. Is there anything that we can do to get those people vaccinated, Hilary?
For anyone who is absolutely housebound, and housebound in the definition that they don't go out to for a hair appointment, they don't go to a hospital appointment, except so hospital transport will be taking people to vaccination centres. But if you cannot go out of your house at all, there is going to be a roving programme. Problem, we can't do that at the moment because MHRA have not said yet that we can transport the vaccine to sites other than where it was actually delivered to. This is because of the fragility and the requirements of the vaccine. I think everyone will be aware from the news that it starts off having to be stored at -70 degrees and then has to be thawed, and then there's a short shelf life between it being thawed and moving out. So at the moment we can't go out to those in their own homes, and at the moment there are pilots starting of taking small quantities out to nursing homes, and those are being, as we speak, assessed across the country. So it is a continuously moving programme, because remember, we have only had this vaccine approved for 2 weeks.
Thank you. And another question on people who may struggle to get out of the house. A couple of questions on whether people can accompany relatives or people they care for to the vaccination sites to support them.
Yes, certainly. One person only, though, please.
Thank you. Some questions about other community sites. So a few people have asked why other areas of the country are vaccinating in community sites and we are not. And I think we've had one question asking if we know what other sites we're going to open for vaccinations yet. I wonder if you're able to answer those, Hilary.
Shall I take? Or I'll have a first bash at this, give Hilary's voice a little rest. So That's absolutely right. There's a plan overall from the government nationally, as I've kind of touched on, that we have the hospital hubs, then we start to have the vaccination centres and vaccination services as well. That takes a bit of time to organise. There's quite a complicated logistical and operational sort of setup for that to happen, to have the vaccines, which Hillary's described, are really, really cold coming in, and then all the equipment and the staff and so on. So we're just working that through, and those are occurring in a kind of a number of waves across the country. So we're expecting within the next couple of weeks, probably just after Christmas, that our local vaccination services and the vaccination centres will start to open up to make it really easy for people to access their vaccine. But that doesn't stop us from getting on with what we're doing now. We are using up all of the vaccine that we've been allocated by the government. We're actively calling forward the over 80s as that very first group and asking them to come to the hospital hubs to be vaccinated. So we're making good progress, and people will start to see those other sites start to open up in the new year when we've got all of those plans in place.
Thanks, Alex, and thanks for giving Hillary's voice a rest. There's another question around communication and publicity that you may want to take as well. So what sort of publicity are we intending to use for people who are not using digital technology, not in contact with a community group or PPG?
So I guess that's part of the conversation we want to have here. I know it's a bit difficult because it's not quite a conversation because we're having to do it in this virtual way. But I'd be really, really keen to understand from representatives on this call how they can help us with that. We have got a mammoth task in front of us to try and reach 1.1 million people in our patch. So we need as much help as possible from everyone to get that message out. We will send you materials digitally, we'll send them printed if that's what you need. We really need your support to reach out to all of the communities that are possible. We're working with all of the partners that you might expect. So just this morning, I was talking with the City Council, for instance, about their plans for their Arrow newsletter in the new year. We'll be looking to work with that. We'll be looking to put posters up on lampposts all across the city. If we can find the right way to do it, we'll be advertising on bus shelters. You know, all of that is absolutely within our thinking. I'm confident that we'll have the right mix of different solutions. But again, I really need the help of everyone on this call to either remind us of some things that we might have missed or forgotten, but also to really help channel that messaging to the people and the organisations that you represent. So please, can I ask for your commitment on that? And our commitment back to you is we'll give you all the information you need. We just need you to be sharing far and wide, please.
Thanks, Alex. And as you're on a bit of a roll there, I think there is another one for you. There's quite a few questions coming about data. So are we able to update people on the number of vaccinations, the number of people who've turned them down? Is it information we're going to be producing and updating? So
right now the answer to that is no. So we've been asked by the NHS centrally, because this is a really gradual programme of rollout. We've been asked by the NHS centrally, of course, to send really regular updates back up into the centre of the NHS of how we're doing and how vaccinations are going and how many we've deployed. But at the moment, we're not releasing that locally. That I'd imagine will happen in due course. Nationally, the government will want to start to share the information at quite a detailed level. Now, the key thing is that people need to wait for their letter, come forward quickly when they do receive that letter, and in the meantime, keep sticking to the rules, keep wearing your mask, keep keeping your distance, and we'll let people know how things are going in due course.
Thanks, Alex. A few questions on how people can advise people who may feel they've been missed off the list or the call for vaccinations. So if people are working with or supporting someone who feels they should have been invited and are in a priority group, but they haven't had a letter, what should they do?
I can answer that if you'd like. I mean, that very much everyone who is registered with a doctor will be on a list. And that is why people are being asked, so it is people's duty to get themselves registered with a doctor if they are not already registered, because this whole process is working on people's NHS numbers.
Thank you, Hilary. And then another one for you, if that's okay, Hilary. There's a couple of questions about testing outside of the priority groups that we currently have. So do we have any idea of when mass testing for the whole max vaccinations for the whole population will be available?
No, at the moment, the whole programme goes down to people 50 and over. Then it is hoped that there will be the next programme, which will be the 18 to 50-year-olds. But people who are at risk from some condition between the ages of 18 and 54 will be called.
Thank you. Question about how deaf people can access vaccination. So I'll read this one out in full. We've been waiting for Public Health England or Department of Health and Social Care to produce guidance about the vaccine in BSL, accessible to deaf people. There's only one video so far published, which doesn't say you should wait for a letter. Will the letter make it clear that deaf people should book appointments using the BSL 119 service? I don't know if you wanted to pick that one up first, Alex.
So yes, absolutely, we'll want to make that work. And again, that's one of the really helpful parts of this conversation, to really understand the sort of, the nuances, how things are landing at the moment, what needs to be better for the future. So I think we will probably want to rely on the national system so that we get one BSL translation, one route for people to book. But if that's not coming forward quickly enough, then we will need to do something locally. But again, the help and support of representative groups here will be a really important part of that. So I know that sounds a bit vague, and I apologise for that, but we're really conscious that I've seen also a question about visually impaired citizens as well. I'm really acutely aware that we'll potentially be asking people to come at short notice to a location which they wouldn't be that familiar with, or potentially not familiar with at all. So we are going to have to think really carefully about how we manage that. So I don't have an easy answer for you right now, but we're really aware that that's definitely a challenge we're going to have to face into. I don't know, Hilary, if you've been any other conversations around deaf or visually impaired citizens.
Certainly anyone can come with a helper, they can have an assistant. So that is the very best thing. I know all the national guidance has been produced in Braille as well. If those people have been identified on their GP records, it will be known about. I think that's as much as I can possibly say at the moment. It is not that there is definitely plans in place for all cohorts, all groups with special needs.
I think it's probably worth noting as well, quite a few comments and offers of help from people who work with various different communities, groups who may have different access requirements. So what we'll do after this meeting is we'll go through those offers of support, and if you expect us to be in touch, so if people can help us to communicate with and reach a specific group in the population, then we're more than happy to take that help. That's really, really useful, and thank you to the people who are offering to do so. There's a specific question on people who are pregnant and thus can't get the vaccine. Is there a process in place, Hilary, to follow up, invite those people at a later date?
Do you know what? I'm going to be absolutely honest. No, I know that they can have the vaccine after the baby is delivered, and if they are not breastfeeding. If they are breastfeeding, they can't have it until after they have finished breastfeeding. I'm not aware at the moment of a catch-all situation that catches them after that, because actually, by the very nature, they will be under 50, and so we are in the next cohort down. So the next group down, not the cohorts, I misused my language there, the next group down. This vaccination programme at the moment goes down to the age 50, unless you've got another health condition. And that is the thing. It's if you've got another health condition and you're pregnant, then there should be a system to know when you can have your vaccine or to recall you. But to be honest, I think the programme has moved so fast, it hasn't got that built into it yet. And that's not just us. It is not in the national guidance either.
Thank you. I think some recognition there. This is so fast moving that the planning hasn't quite got that far yet.
No.
There's a specific question
We need
here
to
about
take that away though, because
yes,
and I think what we will need to do is escalate that through region and up to the national programme team, because I have not read anything that says, how do we catch that group that we have missed because they were pregnant or they were breastfeeding?
point. Thanks, Hilary. There's a question about the process that people book on with, so I'll read this one. Would there be a helpline to answer questions from the public or from people booked to have the vaccine? Some may need reassurance confirming booking or checking if it's genuine, and would this helpline have interpreters? So it's maybe one for you to take first, Alex, and there's some other queries about the booking process. So I don't know if you could talk about how people book on and what support there is to book on.
Absolutely. So I think, as Hilary's mentioned, there for a period of time might be two sort of systems or routes or ways of things happening. Because we're trying to get this off the ground really, really quickly, we've got some local setups going. So out of the two hospital hubs at Sherwood Forest and NUH, there are some teams within there, a mini call centre essentially, that are receiving the phone calls from people once they've had their letter. And that's part of how the appointment is made. And they also have the knowledge and skills to answer specific questions that people have. When the national programme for that appointment booking, we call it a call and recall system, when that appointment booking system nationally starts to come on stream, which hasn't quite yet been confirmed. It was supposed to be as soon as this week. I think I don't think it will be this week now, and it will be probably just after Christmas, I'd imagine. Again, be a national call centre. I'd imagine in my head, it's very much like the 119 number for testing. I wouldn't be surprised if they ended up using the same number, to be honest. Press 1 for testing, press 2 for vaccination, I don't know. But that absolutely will have all of the experts, all of the information, all of the knowledge needed to answer people's questions and get them booked on in the right way. So for now, the key sort of situation remains. People should wait to receive their letter. Within the letter, that has the magic phone number and what people need to do. And the people on the other end of that phone will be able to answer any questions that people have and take people all the way through to from receiving the letter to knowing when their appointment is and where they need to be.
Thank you, Alex. I've just grouped together some questions on how the vaccine actually works, Hilary. I'll just put these together to you. I mean, these are the simple things that a lot of the people on this call will probably be asked. So how long does it take to work? How long after you've had it can you see other people and start mixing? And how long does it last for?
So answering those questions in turn, you are not fully covered or protected until 7 days after your second vaccination. And even after that time, we have to continue wearing our masks, giving space, keeping socially distanced, sticking to all the tier rules, because that does not stop, even for those who have been vaccinated, until the government lift all the restrictions. Because although you may not be affected by the illness, you still may be carrying it. And we have to say, we know it's only 95% protective. So there is still a risk of you getting the COVID illness. And for the final question, which is, so how long will the vaccine last? No one actually truly knows, because literally it has been developed within the 9 months since we've had COVID. All the trials only went on for 4 months. So we have no data nationally or worldwide at the moment beyond 4 months. So it may be that it's like a flu vaccine, that we have to have this annually, or it may be they will be looking at all the data and seeing what that period has to be between, are we revaccinated or does it last lifelong? Because we know that some vaccines like TB, you only have once in your life. And they do not know at the moment. And it will depend probably on which vaccine you have had. At the moment, we are only using the Pfizer vaccine, And it may be different if we get the AstraZeneca vaccine approved and we move on to that one. But we don't know at the moment, and no one knows.
Thanks, Hilary. I think we've got 4 minutes left, and I know it's a hard stop at 1 o'clock, isn't it? So I'm just going to do 2 questions really quickly. That I just wondered if you want to just kind of make any comments to close. Well, I'll ask them together so you can cover them both. So somebody has asked if we are going to be sharing information about the timing for the rollout to different priority groups to manage expectations, so people know when they're likely to be called. And then we've had a question about new arrivals to the UK who may not have registered with the GP or know how to. Will they be missed? And is there any contingency for that? So the order, the timings for the priority groups, and what we do about new arrivals to the UK who haven't registered the GP.
Sure.
At the moment, there is no way that we can give timings for the priority groups, because actually no one knows at the speed at which the vaccine is coming into the country. There has been slight delays of the vaccine coming into the country because they can't make it fast enough in Belgium because they didn't have enough raw ingredients about a month ago. So there is the limitation factor for the whole country is the amount of vaccine, because at the moment they are distributing across the country every bit of vaccine that is coming into the country. So that is the limiting factor. What we would love to think is that something which is much easier to use, which will be the AstraZeneca vaccine, because it doesn't have to be stored at these low temperatures. It can be transported anywhere. It can be done like a flu program almost. We would love that to be approved and come on board, because then we can really ramp up the vaccination program faster and faster, and that will mean that we get through the groups quicker and quicker. But we have to say we've got 1.6 million vaccines to give in Nottinghamshire, so it is going to be a long program.
I think for a lot of the questions, it's the information we've got, we'll share it as soon as we've got it. I think we're early in life with this, aren't we? And then is there anything you can say about new arrivals to the UK, Hilary, just as the final question?
I know that anyone who's on an asylum seeker list and is in Nottinghamshire and Nottingham City will be picked up. The only other way to be picked up at the moment is to register with a GP.
Okay.
Lewis, shall I try and sort of wrap up? I know, Hilary, you might have to go straight at 1 because you've got another meeting, haven't you? But shall I try and do a few minutes wrap up and talk about what happens next?
Yeah, that'd be really useful. Yeah. Thank you.
So I guess, I mean, again, I want to say thank you. Thank you for your time. Thank you for coming to the session at quite short notice. And thank you for that incredibly rich and helpful set of questions. I hope we've been able to answer many of them. I know we haven't been able to answer all of them, and we literally haven't got to a good number of them. So we will pick those up and try and get a written answer to you as soon as possible. So key things again are, we'll send more information to you. Please kind of cascade that to your communities and groups as much as you can. Key messages are, wait to be called forward. Please don't contact the NHS for your vaccine. Whilst you're waiting for your vaccine, you have to continue to stick to the rules. That's the only way you can help keep yourself, your family and your communities protected. And even when you've had your first jab, it's a number of weeks before you're fully protected. So please continue to be really careful and sticking to the rules. I think because of the really good turnout and the huge number of questions we've had here, I think we'll probably want to do this again. It's probably mid-January or something like that, because we'll have a whole load of new information then. Lots of things, I guarantee, will have changed, and we'll have moved forward another few weeks with the programme. So I think we'll look to do this conversation again. But for now, if colleagues on the call could look out for the pack of information which we'll send out shortly, and really happy to hear any more questions that prompts, and anything else we can do to help. So I think that's probably all I want to say. I don't know if you have got 10 more seconds, Hilary, to say any final words from you.
No, I mean, thank you for everyone who's taken such interest in the programme. I think my real plea is for people in specific community groups to try and spread the message in the community and try and help us to encourage those people to come forward for vaccination. That is what I see is going to be a real issue, because nationally there are groups that are not coming forward, as they are called, and we need to reach those groups, because otherwise we will still have pockets of COVID circulating in our communities, and we won't all be safe to go shopping unless everyone gets vaccinated, because we all meet people we're not expecting to meet.
Thank you, Hilary. So I think, yeah, thanks once again, everyone. I wish you a happy Christmas if you're celebrating that, and a break if you manage to get one. And I hope that we'll be able to talk again at some point in the new year. But for now, if you look out for the toolkit of information that we'll share, that's hopefully a kind of really useful starting point. So thank you very much. That's the end of the call for today. But yeah, hopefully speak to you soon. Bye-bye.